Hello, so we're here from the Spokane Regional Health Department to talk about pediatric vaccines and how they need to be caught up. The vaccines are one of the greatest successes in public health. Vaccines prevent millions of disease, some of which can be life-threatening, and have been approved by the FDA and undergone extensive testing to ensure safety and efficacy. So these are some of the recommended child and adolescent immunizations for ages 18 years and younger. A lot of them you recognize: Hep B, um, IPV, the COVID vaccine, of course, influenza or the flu vaccine, varicella, which is chickenpox, hepatitis A, meningococcal, um, etc. They're all very important, and they are on a schedule by ages, and we'll show that a little bit later. So the pediatric vaccination rates before the pandemic and after the pandemic are showing marked decreases. According to the CDC, about 94% of kindergartners had required vaccines during the 2020 to 2021 school year. And 1% drop, while it may seem small, estimates that about 35,000 children in the United States without having those important life-saving vaccines. So COVID-19 has greatly affected all of us. Unfortunately, one of the outcomes of the pandemic is a drastic decrease in pediatric vaccinations. A multitude of reasons have caused a decline in vaccination rates, some of which are due to a combination of stay at home and social distancing, and non-essential practices temporarily being closed. You can see here the decrease in vaccinations since the pandemic has started. And here you can see that, locally across counties, the percent change from the average of childhood vaccinations has gone down pretty much in every county. Herd immunity is really good for our community. It not only protects the person getting vaccinated, but their friends, family, neighbors, people out in the community that may be immunocompromised. Um, and definitely infants also that may not be able to get all these vaccinations yet. So what can you do to catch up? Catch-up scheduling is available. You talk to your primary care physician or contact the health department. Um, Doses and scheduling may vary by vaccine. Um, the Vaccines for Children program, VFC, is a federal program that provides free vaccines for eligible children. So if you're worried about cost, definitely talk to your provider about that. And this is that vaccine schedule that we had mentioned earlier. And it sort of gives you an idea of when the child should have gotten a dose or multiple doses of specific vaccinations. If they are behind on this, there is a way to catch up. So just because maybe they missed when they were supposed to get their first or second dose, it doesn't mean they can't start later and catch up. Um, who is eligible for the Vaccines for Children program? Um, Eligible children are uninsured, underinsured, Medicaid eligible, Indian Health Services. It covers office fees, giving it the shot, the administration, office visits, and other services. You can go to your pediatrician's office, a pharmacy, school clinics, FQHCs, rural health clinics, or your local health department. And whether you think your child may be eligible or not, definitely check it out and see if they are. You want to be a superhero in your family. So you want to protect your children, family, friends, and your community. You want to protect those that are immunocompromised or have weakened immune systems, and ensure your child doesn't miss school or other activities due to unnecessary illnesses. You want to cheer them on, be positive and uplifting. And that's pretty much all we had for today. If you want to reach out, you can reach us via this website here or the phone number. We'd be happy to answer any questions you may have about this. And just a few references on our presentation today. And now we can open it up for questions. Thank you so much.